So Harford County is a population that's growing. When I first arrived here about 10 years ago, there was 245,000 people roughly. We're over 260 now, and the projection is for continued growth here. So there's really been an effort to grow out the programs, grow out the facilities, and make it a world-class health system here in Harford County.
So everything that I thought this would be is what it turned out to be. The hospital is growing by leaps and bounds. We have a new facility that we're actually sitting in right now in Aberdeen. The medical staff has grown, the facilities, the different types of procedures we can perform, the different subspecialties that we offer, everything is growing with us, as well as the community.
Being in a growth market like Harford County, where both the population is growing, but just investments in healthcare infrastructure, educational infrastructure, community capabilities is really exciting. And we want to be able to bring next generation technologies, next generation thinking, and being able to be at the forefront of that innovation, both in partnership with our community partners and our physician leaderships, has been really cool to see.
I have been able to develop great relationships with my colleagues, with my patients over so many number of years, and everybody has been so great. It's almost like a family to me here. So this place has been great for me to grow personally as well as professionally.
We have people that have trained at some of the best institutions in the country, at Johns Hopkins, at Mass General, and Memorial Sloan Kettering, and they leave their ego at the door. People are collaborative, cooperative, and it's a wonderful place to work with other physicians at a very high level who are very friendly and care about each other and care about working together.
I think a lot of the providers have grown roots here to the point where they have mentored each other. They have gotten better as clinicians, more skilled, and they look after that next generation of providers who are coming in and help them in the same way that they were helped growing up.
I have been really encouraged and supported as a new physician when I first started to where I am now, which is I have built a full practice and I am in the leadership role also now. So this has been a great place and a great organization for that kind of a progress in my career and as well as in personal development.
So Upper Chesapeake's had a long history in terms of their ability for physicians to collaborate with one another, to feel supportive, and to be a part of a leadership team. So we have a number of physicians who have leadership roles, have grown into those leadership roles after practicing medicine for a number of years in the community and at the hospital itself.
I came here as an associate physician and was able to increase my roles. I was the chief of echocardiography. I'm now the chairman of medicine. I've been on multiple hospital committees. Almost anything that I've asked to be involved with outside of my clinical practice, I've been able to do or achieve here at University of Maryland, Upper Chesapeake.
When I joined as a primary care physician, I transitioned to become one of the hospitalist physicians with the group and quickly grew in leadership, where I took over our hospital medicine group and then took over informatics. Now I became the Associate Chief Medical Officer. And I know what drew me here was the people, and also what kept me here are the people. Providers, healthcare personnel, leadership as well. Very available, very interactive, and that partnership is very palpable compared to other healthcare systems.
UMS as a system really wants us to be at the forefront of innovation. So I have the great pleasure of being part of a few national committees on next generation artificial intelligence technology, new approaches to behavioral health. I'm very passionate about the care of seniors, including home-based care for seniors. And this is a system that encourages that to be part of both local innovation, but also bringing expertise from around the country to our local market.
Now we have a very high level of subspecialty care that we did not have before. We can tap into those resources that are downtown at the medical center, which is really unique for a community hospital.
I think the University of Maryland has really strived to make patient care available across our region. One of the things that has been great about Upper Chesapeake is we often are able to have our subspecialists and specialists come to Upper Chesapeake. That helps patients get the care they need without having to go into the city of Baltimore. I think the organization as a whole is very progressive with technology, and that tends to be a big drive for people like me because we want something that's not stagnant and will continue to grow. A lot of the groups that I'm involved in are actually system-wide groups. Functionally, we work so much better as a system when we're making group-wide decisions. That way there's a communication and uniformity across the system. So I think it's very important that we foster that sort of relationship.
We hear frequently from patients, they want to continue to have their care in their neighborhood. But yet, there are some times where we need tertiary level care. A partnership with School of Medicine to bring several service lines through telemedicine to see our patients while they're in the hospital.
The reason that any young physician should come to this area is for the same reasons that I came to here 17 years ago. We're still growing. We're the only hospital system in the county. My colleagues here are second to none. Very well trained, very well educated, but more importantly almost, they're really good people. They are the backbone of this community, the backbone of this hospital system.
I'm very proud to be part of the medical staff at Upper Chesapeake. I think we have smart physicians that are also proud to be a member of this larger community within Upper Chesapeake, but also within University of Maryland Medical System.
People from all over the United States and all over the world have come to Upper Chesapeake to practice. I came from Alabama, never intending to stay, and 35 years later, here I am. This is a great place to work and a great place to live.
Balance is absolutely a real thing here. There's plenty to do when I'm not at work. Most of the physicians here do live locally, and so it's a very short commute. We also have a very tight community outside of the hospital where we spend a lot of time together as well.
The people here want to make sure that you succeed. So they're going to look after you. They're going to be there to help answer any questions that you have, particularly as you're new either to the organization or new to clinical practice.
The why of the opportunity here is to be in a great community setting, a vibrant and growing community setting, have all the backings of a large academic health system with you, but also to be able to put your fingerprints on the care that we're trying to deliver locally, whether it be program development, a passion for the underserved, a passion for the aging. We say we're small enough to do cool things, we're big enough to be part of something relevant and meaningful, both locally and nationally.